You'll be forgiven for thinking I was trying to get as many abbreviations as possible into a video title. Joking apart though, I thought it would be really helpful to talk about CBT or EMDR, that's cognitive behavioural therapy, or eye movement desensitisation and reprocessing for PTSD, because these are the evidence-based, memory-focused therapies for post-traumatic stress disorder. And because of that, it's likely that if you're suffering from a trauma-based presentation, you may be offered these within the public or insurance-funded private sector. I'm going to explain some of their similarities, how they work, and what would happen during a therapy in this video. So let's explain the process of both. Both would engage with a general assessment. This means they would look at how you are doing currently, what your circumstances are, ask initially briefly about the trauma or traumas, how they've affected you and what they mean to you. They would also ask about other experiences you have had throughout your life, including helpful and unhelpful relationships, the things you find helpful and what you feel you do well. This is part of the therapist understanding or negotiating with you a life context in which the traumas have happened. Often important in assessment is whether you're using alcohol or drugs, whether suicide or self-harm is a question, whether you have had more unusual experiences such as hearing voices or finding yourself in places without remembering how you got there, and whether you're still in a situation which is of risk to your safety. If any of these are in place, other psychological work might have to happen first. So both CBT and EMDR draw on this context and do so to create something of a map of key memories or experiences, which then both would ask what memory you think is best to start off with. EMDR here has a guideline of the worst, most significant, eldest, or most recent of these experiences. Both would also, most likely, then engage with a preparation phase where tools and skills to help you if symptoms become more difficult are offered, and to help with whatever symptoms you may have coming into therapy. These include things like grounding exercises or the peaceful place self-soothing exercises. And do see my other videos if you're interested in these. Then, regarding actual reprocessing, each method differs. After choosing which memory to work with, in CBT, the therapist would establish a start point of each memory, as you would consider it, then the end point when you felt that the immediate danger of the situation was over and that you were safe again. Then CBT would ask you to go through the memory in detail, every part of what happened, often with the therapist asking you to feel and experience the things you were going through, ultimately trying to do so with your eyes closed, putting yourself back in the memory. This is done because the aim is to overcome the avoidance of this memory, and in doing so, put a time tag on this unprocessed memory. CBT considers a trauma memory is one that hasn't had the attention on it because of the threat of the trauma to become a memory like any other. You'll find more on this on my video, What Happens in PTSD. An additional phase of CBT is where hotspots in the memory or occasions of specific meaning arise. This pertains to CBT's consideration that trauma also alters the belief the person has due to the meaning they derive from the trauma. These are then considered with techniques such as thought challenging or other methods involving interaction with the memory itself, such as having the victim talk to the aggressor or have them help themselves in that situation. In my experience, this is often not needed because people remember things which often deeply challenges the meaning involved. For instance, a person may remember that other people tried to help them during the trauma, which may challenge a perception they were on their own or that the world is an unsafe place. People are not to be trusted. This process continues with each memory until you feel that the memory no longer possesses the upset it did, and this should coincide with remission in symptoms such as flashbacks, nightmares, and such like. In EMDR, the therapist will ask you a series of questions about the memory you have chosen, including the worst part of the memory, such as the sound when the car hit yours, or the sight of the perpetrator. The belief you have about yourself now, how you would rather see that memory now in a positive light, how much you believe that alternative thought on a scale of 1 to 7, the emotions you have remembering this memory, how powerfully you experience those emotions out of 10, and where you experience that distress in your body. This is because EMDR maintains that PTSD comes from a trigger memory causing a series of memories to dysfunction. Let's look at a diagram for this. Let's say I have a belief involving abandonment. I will have had lots of different experiences building up involving that, until a triggering trauma, which reflects that abandonment again, alerts our mind to go into fight and flight regarding it and survive in light of it. The questions the EMDR therapists begin at the start of the session reflect an attempt to lock on to that memory chain, the worst part of the memory, the meaning of it implicit in the negative thought you had, the emotions involved, and the physical sensations involved. The therapist would repeat side-to-side movements called bilateral stimulation, either through asking you to follow something with your eyes or offering taps and sounds. Then ask what came to mind as those movements happened. Our minds can go anywhere during this process, to different parts of the memory, to other memories, to imaginal images or feelings or bodily sensations. And this reflects different points on the memory chain, organising and processing itself. This continues with the therapist sometimes asking questions if the process gets stuck, or when it appears that the memory is resolved by the client repeating things time and again. The therapist would then take you back to the worst part of the memory until no or very little distress is recalled. At this point, the therapist would use how you would rather see the memory and pair it to the memories you have recalled. There are a few theories as to how EMDR works. For instance, one holds that the eye movements replicate natural processes your body and brain goes through in order to process memories, and so those movements do it for us. Another maintains that those movements distract the animal brain from disrupting the processing the human brain is trying to do, so the human brain can put time tags on trauma memories. Please see my videos on biology and PTSD for information on exactly those brain structures. Again, like CBT, this process is repeated with memories of significance until all feel less distressing and PTSD symptoms are in remission. So I really hope that summary of each method is helpful in deciding which one is right for you. Let me share some of my observations about each of these methods when we address the question of which to choose. But please hear these as being my opinion as one practitioner and recognise other clinicians will have come to their own conclusions. So EMDR is shown to be a faster process. This has been shown with some research findings and does not assume, as CBT does, that you go through every detail of what has happened. You might, but this is according to what just comes up and does not assume you will. This, for some people, can be its disadvantage. You do not know where EMDR is going. Now, this is always a danger in trauma work because trauma memories are not discrete like normal memories, so that danger is inherent. However, this is perhaps CBT's strength. While slower in achieving its results, the client knows exactly what the plan is for a session, where the memory will start and where the memory will end. CBT, like EMDR, has a wealth of evidence showing it is effective in resolving the symptoms arising from trauma. Have you had either therapy? Are there things which you have found helpful or unhelpful about either? Please comment and join in the discussion about this. And of course, if you've liked this video, please like, subscribe and share. I hope you found this helpful and thank you.